This episode of the podcast is brought to you by our friends at Regrow, the premier cloud-based cannabis supply chain management system.
Question for all the cannabis operators out there. Are your SOPs tied directly to your cultivation plans? Can you easily manage your inventory and workforce and vendors from a single system? Can you manage compliance across multiple licenses and states? If you said no to any of these questions, you need to stop what you're doing and talk to the team at Regrow. Compared to other software systems on the market, when you choose Regrow as a strategic business partner, you'll get all aspects of regulatory compliance built in, with the added value of workforce management, inventory, SOP management, and reporting and metrics that allow for companies to scale successfully. Regrow is the single pane of glass view into your entire supply chain, and the software will help you increase your revenue while keeping your entire operation fully compliant. Give them a call or visit their website at regrow.io. That's regrow.io. Regrow, the premier cloud-based cannabis supply chain management system. What's up, my fellow people of the plant? In this episode of Cannabinoid Connect, I'm talking with Nick Schlienz. He's the director of research at Realm of Caring, which is a 501c3 nonprofit that has served tens of thousands of families and healthcare professionals since its inception in 2013. Nick is a clinical scientist studying cannabinoid science to expand the scientific evidence for the use of plant-based therapies. With Realm of Caring, Nick has established an observational research registry to further the nonprofit's mission of examining and characterizing how cannabis products are utilized by individuals living with a wide range of major medical and psychological conditions. During our conversation, we discussed recent cannabis research, including the epilepsy manuscript they recently published, medicinal dosages of CBD for individuals that are curious to try but haven't yet. We also discussed cannabis positive effects for mental health symptoms. Last, we discuss Realm of Caring's observational research registry and how they're helping people find doctors and products that best match their conditions. So I hope you enjoy this episode of Cannabinoid Connect as you watch or listen to my conversation with Nick Schlienz, who is the director of research at Realm of Caring. Nick Schlienz, what's going on, man?
Not much, Kevin. How are you?
I'm doing well. Thank you so much for making time for me and the audience today. I'm excited to talk with you. You do important work, working at Realm of Caring, which is a 501c. It's a non-for-profit, but y'all do really research and the science behind cannabinoid efficacy and talking about really how this plant and the cannabinoids found within the plant really can be beneficial to us, which is very, very interesting. And I really can't wait to dive into all that. First, let's kick it off by allowing the audience to get to know you and your background, Nick. So tell us a little bit about, your journey and your professional career and what led you to where you're at today, being the director of research at Realm of Caring.
Sure. Well, I did most of my my training at the University of Buffalo, Kevin, and received my Ph.D. from there in clinical psychology in 2015. I did a one-year residency for clinical work at the VA out in Bedford, Massachusetts. And then after Massachusetts, that took me to Johns Hopkins and Dr. Ryan Vondre, where I began doing the great cannabis work for 3 years, and then right to Realm of Caring afterwards.
So cannabis work, let's talk specifically about that. I mean, was this new to you at first? Was this something that you had kind of known about when it came to cannabinoid therapeutics? Did you have experience with the plant? Like, what did all that entail, that process?
Yeah, I actually didn't have much, Kevin. In Buffalo and even in Massachusetts, I had really focused my research interests on nicotine and tobacco, especially, how people, in their brains basically act when they're deprived from nicotine, which is always fun, having people come in after stopping smoking cigarettes for about a day. They just love to be in that kind of setting and seeing me all teary-eyed. But around that time in 2015, while I was at the VA, that's when I think, I don't want to say reforms began to pick up, but, I think the policies were changing. And that coupled with being, around a lot of veterans who were advocating for use of cannabis for their own medical conditions really piqued my interest, and that's when it began.
Yeah. I mean, it's funny you bring up that specific community, veterans. And I've had Craig Henderson on, who's the founder of Extract Labs, and he was actually a former Marine, and he talked about just like the acceptance of alcohol use as it relates to veterans or even active military personnel, and just like it's okay, right? It's just kind of part of the culture. And even after serving, some of these veterans tend to go in that direction and use alcohol when there may be better alternatives. So you're saying that your eyes kind of were open when you saw that there was a veteran community already kind of looking and advocating for cannabis use and more access. Is that right?
Yeah, definitely. And as a psychologist and working with returning war veterans, men and women from coming back from Iraq and Afghanistan, kind of like the gold standard for PTSD is prolonged exposure therapy, which clinical trials show time and time again that has really strong treatment effects. But it really requires folks to go into some pretty dark places and really kind of reprocess these memories and images that continue to invade their lives. And understandably, a lot of people don't want to go through that. And I think they're looking for alternatives to that. So, I know kind of the jury's still out in terms of the effects of cannabis, on PTSD, but, I think research is growing in terms of its effects on sleep quality, and mood. So it looks encouraging.
Mm-hmm. Yeah. And I mean, when we talk about different ailments that can emerge, I mean, a lot of that is rooted in stress, right? And so from what at least I've learned with guests that I've, had on the podcast, or even research that I've done on my own online, is that, cannabis is a big time stress alleviator. And that opens the doors up for a lot of different things, because again, the root of kind of everything starts with stress. Would you
Mhm.
agree with that?
Yeah, I'd say, how we cope with things as human beings, um, you know, sets the stage for, what our days, what our weeks, what our months, years look like. So when we've got more of that cortisol pumping through us from, stressors, that vary in nature, it can make, a lot of things pretty darn challenging to handle.
Hmm. Yeah, absolutely. So Nick, I mean, you're intrigued, your eyes are open when you see this veteran community that's advocating for cannabis use and access. And so then, I mean, do you dive head in? Like, how does this start in terms of your path of research when it comes to the efficacy of cannabinoid therapeutics?
Yeah, well, when I first got to Johns Hopkins, into Ryan Bondre's laboratory, it was just kind of you kind of learn as you go, ask questions, anything that I could get my hands on, materialize. I read. I thought it would be a relatively decent learning curve compared to nicotine and tobacco, but quickly learned that that was not the case. I mean, the plant is fascinating, and we're learning more and more about the plant each day, but also the endocannabinoid system is equally as fascinating. And to think of what that will, powers that will, kind of unlock down the road, also intriguing. But yeah, dove, kind of just, head first, and I'm still learning each day.
Yeah, I can imagine. Like, we talked about before we've recorded, is that we're barely scratching the surface with this plant and learning the science, behind it. And so that's a great segue. Let's talk about some recent cannabis research that is particularly intriguing from your point of view, or some noteworthy studies that have recently come about that you'd like to call out.
Sure. Well, I think the big one is our recent publication about that's looking at the effects of CBD, on epilepsy and seizure disorders. For a while, there's been a lot of anecdotal reports about the effects of CBD on seizures, and great stories too. For example, Kevin, one of our co-founders, Heather Jackson, her son Zakai, has a very rare form of epilepsy, and would have, hundreds, of seizures per day, if not more. And, nothing seemed to work treatment wise for him for the longest time. They'd see specialist after specialist. And it wasn't until they tried CBD where Zakai really got, his life back. Um, Heather often, the phrase she likes to use is from hospice to health. So it really was transformative in that, after not really being able to interact with him because of all the symptoms and seizures and their after effects, she now, can just spend a lot of great quality time with Zakai, and his older brother, and their family and husband.
Mm-hmm. In that particular scenario, did Heather really have to be like Zakai's own advocate or an advocate for Zakai's health and like basically look to CBD as a potential alternative, or was that brought up by their particularly or by their healthcare provider at the time or their doctor?
Yeah, I do know that, one thing that always impressed me, and still impresses me with Heather is that, the word used, advocate is, completely accurate, really doing kind of the background work and going above and beyond to just know what's out there and know what's possible, because the healthcare system alone is challenging to navigate. Um, I can't imagine what it's like when you've got a child or children that have very serious health conditions, that added stressor.
Right.
But yeah, I think she fought, from day one and still fights to just advocate for, the use of cannabis, based on solid empirical evidence.
Mm-hmm. And another example of that, I think, with a partner of y'all's is Charlotte's Web, right?
Mhm. Yeah.
Yeah. For those listening, I mean, why don't you go ahead and share that story of the origin story of Charlotte's Web?
Yeah. So, Charlotte's Web was, founded by the Stanley brothers in Colorado, and a similar story to Heather's, but I think this one, grabbed, you know, you know, the hearts of the country in that, Paige Figge uh, and her daughter Charlotte, kind of, gained notoriety because Charlotte was having, had an equally, egregious and terrible epilepsy, and seizure disorder, and was responding to nothing. I believe Paige was like Heather wasn't sure if she would be saying goodbye soon to Charlotte. But at one point, Paige had approached the Stanley brothers, and they created a very special formulation, just for Charlotte. And to this day, that's why they have the name of their company, Charlotte's Web. And Charlotte responded, exceptionally well to that. And just like Sakai, Paige was able to, really have, typical mother-daughter moments, with Paige up
Right.
until last year when she passed away, unfortunately. But um, I think one great message kind of to take away from it, Kevin, is that a lot of positive press was received from that story, as sad as it was, um, to really, educate the country and other people about, this movement, cannabis and cannabinoid therapeutics.
Yeah, I would definitely agree with you. I mean, that story was so impactful while tragic that it really, like you said, was kind of a catalyst to really get people and medical professionals to start looking at CBD as, a real solution to, like you said, the epilepsy or seizure disorders that, people may have, especially children, right?
Mhm.
And while prohibition of the last 100 years has really put a pause on the amount of peer-reviewed research studies that would be out there, we know that CBD cannabinoids are good and help with seizures, epilepsy, things like that, right? And we know that
Mhm.
there's also anecdotal evidence that suggests that CBD is good for inflammation and anxiety, and THC is good for appetite, right? So, um, are there any other, studies or findings since you have been the director of research at Realm Caring that is also kind of just surprising or fascinating in your mind?
Yeah, well, it was interesting, Kevin, because with our epilepsy paper, we didn't find any effect of CBD on the main seizure variables, like seizure severity or the frequency of seizures. But similar to the variables we just mentioned, like sleep among adults, mood and anxiety, quality of life, we saw those improvements, which, in my opinion, are equally as important because
Mhm.
those also form, how you go about your day and how you deal with the day.
Right, right. Is THC one, like in the case of Charlotte's Web, like I just want to be clear in my own head, is CBD really kind of the catalyst, the main driver or main cannabinoid that addresses quality of life as it relates to seizure or epilepsy disorder, or does THC play a factor as well?
Yeah, I'd say with the case of, especially Charlotte's Web and the majority of products that people use who are in our research registry, it's predominantly high CBD and very, 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 very low THC, where it's, in the ballpark of, less than 1 milligram or less than 2 milligrams. So nothing that would have any kind of real therapeutic benefit. So
Got you. And that makes sense because if we go back to the science, we do know that we have a CB1 receptor and we have a CB2 receptor, right? The
mhm,
CB1 is located in our brain, where that really is what the THC cannabinoid binds to. And then CBD binds to the CB2 receptor, which is really in our immune system and within our gut, right? So they kind of
mhm.
process in different ways. And so speaking of, the efficacy of cannabinoid therapeutics, we're currently living in a mental health crisis, right?
Yep.
We're still kind of living through a pandemic. Delta is on the rise. People are they're losing jobs, they're out of work. There's just a lot going on. And we've seen that consumption rates for cannabis, particularly THC products, have really kind of risen and have been almost equal to alcohol consumption rates during like the height of the lockdown, right? And so
Yep.
we are seeing that there's positive effects for mental health symptoms when we're thinking of cannabinoid therapeutics. Is that what you're seeing, particularly in the case of like THC products?
Yeah, even with our, our other recent publication, that focused on anxiety and mood. Um, and just at one of the first assessment time points, we saw that it helped. Um, I believe more so with depression, but at follow-up time points that were kind of, 3 months, 6 months, 12 months out, it helped with both anxiety and depression. So that was real promising to see. And that by and large was CBD. Um, I'm not aware of, you know, THC's effects, but I would also wager your guess that for some medical conditions, for example, thinking back to post-traumatic stress disorder, I would imagine that THC would certainly probably have a therapeutic effect, in terms of, you know, you know, eliminating or just kind of toning down the arousal that, that tends to be accompanied with that disorder. And also helping with the nightmares and the sleep.
Hmm. Yeah, and I would imagine and well, I know this personally, and of course from others, that dosing is very important, right? If you're one that isn't familiar with any type of cannabinoid product, um, especially edibles, they can catch up to you. So what have you seen in terms of like medicinal dosages of CBD for individuals that may have not tried it in the past? And what would you suggest someone that's maybe kind of curious?
Yeah, I think the one thing that our care specialists tell folks that call in for guidance is to really start low and go slow. I mean, at dispensaries and people that are making it on their own, you might see edibles that go as high as 100 milligrams, and just to me, obviously, that's past the point of therapeutic. Maybe not for the daily user, but for someone first starting out, start low, see how your body responds to it, because we know that pretty tricky with edibles because, Ryan Vondre and colleagues had a study back in JAMA, years and years ago, but basically found that when they did a, surveillance of the market, I believe in Colorado, that a lot of the products at that time, were labeled inaccurately. So they were, potentially, the dose was like too high or it was too low. So you could one or two things could happen. It'd be easy to overdose or underdose. Um, and that's a lot more tough compared to if you're like, vaporizing the cannabis or smoking it, kind of that immediate effect. With edibles, it's a much longer time course, 90 minutes in that ballpark, sometimes 2 hours. So yeah, play it safe, go slow.
Yeah. And if you're not doing your research on where you're buying from, like you said, there could be mislabeling in terms of what's actually in the product. And then even taking it a step further, like if it's not high quality, there could be an uneven ratio amount in one particular corner of, like, say, a brownie mix or a gummy mix, right? So all that stuff is important to really do your due diligence and research around, like, what products you're buying, where you're buying from, how they sourced it, is there certificates of analysis. I mean, all that stuff is very important.
Yeah, because one thing we know in the literature is that THC or CBD or by and large any drug, when you ingest that drug, the effects can really vary, remarkably based on how that drug is delivered via an oil or a food product. And I think that probably partially explains why, while Canada had legalized, cannabis at the national level, edibles, they still didn't have a game plan for those. Those still were, on the docket, if you will, because of just that very fact that they're more tricky to regulate and can lead to any number of different outcomes.
Yeah, I remember that. I don't even, have they passed that? Like, are edibles now available and in the market in Canada?
I don't know, but that'll probably be the first thing I go and look up after, this
Yeah,
conversation you're having.
because they were talking about like cannabis 2.0. That was the next phase they were in, and I think that they were in the last time I talked to someone from Canada, they were in that process. So I'll have to look at that too. Yeah.
Yeah,
We're so
yeah.
focused on what's happening on in the US because it's like everything's happening so fastly or so quickly,
Hmm.
it's crazy. But
Yeah,
let's shift gears and let's talk about realm of caring now. So
yeah.
from my understanding, really, your your data is basically kind of, it's patient driven, right? It's people that
Hmm.
are utilizing cannabis or CBD products, and they're basically just kind of opting in and saying, look, this is kind of how it's making me feel, this is how many times I'm taking it per day, frequency, all that type of stuff. And from there, you're utilizing that data to kind of see how it's working and what's happening. Is that an accurate way of
Yeah,
describing?
yeah, yeah. That's perfect. That's spot on. And that's largely because the traditional ways to evaluate efficacy for any of these products would be clinical trials. Um, but since there's a number of factors going on here, but say for example in the case of epilepsy, one of the main products that has been approved for a small number of seizures is Epidiolex. However, if you've got a case of epilepsy that is rare, it'll be harder to get into any of those clinical trials. So it really makes accessibility, um, a big factor in not being able to consume it for therapeutic purposes. Um, Same with cost too, by and large. So, knowing that, what do? We go to our registry and we basically people come in every 3 months, online and just tell us what they're using, how they're feeling, and their mood, their sleep, chronic pain, and a variety of other conditions, just to get as much data as we can to kind of just build that knowledge base
Mm-hmm.
for what's out
And
there.
and for some of those questions, I mean, is it as specific as, like, what product is this? Like, what brand? Who are you buying from? And I ask because the follow-up question is there maybe a trend or your pattern that you see in some cases where some people that are sharing this information are not feeling the efficacy, and you can kind of point back to, well, maybe it's because this brand that you're purchasing from, um, you know, doesn't really have what they say they have into the product.
Yeah, that's a great question, Kevin. I mean, by and large, we see, a lot of people using it, and the doses really vary as well, depending on the condition. Conditions such as, for instance, cancer, sometimes, they're exceptionally high because it's a treatment of last resort. So it's, in the terms of CBD, it might be, well, let's see how much you can tolerate to see, if it'll have a positive effect. But for other conditions, it could really, be much lower, 50 milligrams, 60 milligrams, in that ballpark for CBD. Um, and while many report positive effects, there are folks that, will be, candid and say, hey, we're not seeing anything. And this isn't really, that cheap. So we're going to have, that's why we stopped. And that's helpful to know as well, including folks that will sometimes report that they had some side effects from the CBD over time. So learning that is equally as important, because that same kind of data is also gleaned from clinical trials.
Yeah, totally. I mean, we on this podcast also, we cover the adverse effects of cannabis use, right? I mean,
Mhm.
cannabinoid hyperemesis syndrome, other types
Yep.
of issues that people experience. So, what are some of those side effects that people have said they've experienced?
I think, especially for like younger folks, I think, if kind of off the top of my head, there potentially times where, it was nausea, or, some, very mild, GI symptoms, lower GI symptoms. And I think that was really the extent of it. And that was, pretty much with like extended use over time.
Gotcha. Yeah, but I mean, as you mentioned, more positive than, of course, negative side effects, more positive feedback, which is what I would assume, just because of kind of what you hear anecdotally, right? And kind of what we're learning more and more through research and public support, and just that wanting more access to the plant. And realm of caring is playing an important role in that, because as we talked about a little earlier, we touched on it, with federal prohibition, we've really, like we said, we put that pause button, and it really takes entities like realm of caring to do the work, and to do what should be done in the medical side of things, but it's just not happening.
Yeah, it's unfortunate that it's slow like that, but one of the reasons that I joined Run with Caring in the past year was just my admiration for having worked with them for, you know, basically 5 years up until that point, was the great work that they do. Aside from research, we've got other arms that really focus on education, educating clients that call us, healthcare providers on dosing and dosing instructions, but also community as well, because community is a building block for several amazing things. So getting the word out, working with other nonprofits, um, kind of strive to just show that it's with the right knowledge, and kind of keeping your mind open. It's not necessarily a bad thing to consider, if you're thinking about it.
Yeah, I mean, the notion of the future of medicine has come up quite a bit on this podcast, and not to say that cannabis is the one and only medicine, or that's going to be part of the future, but it's going to play an important part. I mean, you talked about the ECS, our endocannabinoid system, earlier, and there's this lock and key effect with these cannabinoids and how they interact with our ECS, that CB1 and CB2 receptor that we talked about, and so. I know that realm of caring, you guys also help people find doctors and
Mhm.
particular products that really match, I guess, the right medical conditions that individuals are faced with. Is that right?
Yeah, and one thing that I'm proud of is that for any new partner or sponsor, that we onboard, our folks, our director Steve Bond, and Adam Young, who's in our development department, do great work, and that they go and really go to each company or each dispensary and really vet the product to make sure that it's high quality, that it meets all of the standards reviewed in, the certificates of analysis. Assuring people that it's not just any product that we're giving, our two thumbs up on, compared to what you might see at a gas station or 7-Eleven. These are high quality products with people that put a lot of thought, time, science, and energy into, creating them.
Totally. Well, what's Realm of Caring's focus, for the remainder of this year and beyond? I mean, there's a lot of runway here, right? We're looking at like 5, 10, 12, 15 years where this is in the making, right? This is going to be a lot of great useful data that I believe the health and medical industries are going to be utilizing. So what are y'all's plans with this data, and what are you really working toward? What's the overall goal?
Yeah, our biggest thing, Kevin, is really continuing to forge partnerships to get more and more people involved with our data. And we like to look at it on a regular basis because it really kind of, like you said before, it could indicate certain trends about products or use trends or perceptions. So the more we expand, domestically, but also hopefully internationally as well, the more knowledge, the better. But again, off the top of my head, I think we've got well over probably 110 conditions in our database, which is great because a lot of times we'll get phone calls from people saying, "I have this. What can you guys tell me about this?" And although we can't go over the top with our recommendations, it's nice to let these folks know that there are other people out there that are using the product and tolerating it. And ideally, having some great positive effects from that. So again, getting more data, more partnerships, I think will be huge. And as we started out earlier in this podcast, Kevin, the cannabinoid marketplace is incredible to me. Whenever you go online and you look at the products available, in a way, it's kind of nostalgic when I see all like the kind of knockoffs of like my childhood in like the 80s and 90s of like Captain Crunch. That's forever top cereal for junk food.
Fruity Pebbles,
but yeah, the
and all that. Yeah.
There's products that are just crazy. So I think really learning what people use, how they use them, the barriers that get in the way, but also importantly, when they are using them, what kind of advice do they get from their providers, prescribers? Are there interactions potentially with other medications they're currently taking? A lot of questions, a lot of unknowns. And then when you think about other interactive effects like terpenoids and the terpenes, equally as fascinating.
Oh yeah, I mean that's a whole separate discussion, right? The way that terpenes interact with our ECS and just our overall mood and behavior, and in addition to the cannabinoids. I mean, it's the entourage effect is what we've talked about, right? I mean, it's everything and all in the plant. But it's important work that y'all are doing, and I know that I'm very grateful for it, and I'm sure that there are a lot of other people that are out there that need this, right? Because they're looking for different alternatives, because maybe traditional medications or prescriptions aren't working for them, right? And so they're looking for something else.
Yeah, I've been fortunate, in that I've never had to think about, well, I've tried A, B, C, and D, and E for any given medical symptom or condition. I don't know what that's like, but for families that's a kind of an everyday or struggle or a real thing they're facing, that's scary. So I think having the right information and having up-to-date research that's rigorous is important for us and others, especially, to take this seriously and make it a viable alternative.
Absolutely. Yeah. Well, as y'all continue to just, conduct research and collect this information, I'd love to have you back on as things develop. And if you learn new things, breakthrough studies, whatever it is that's worth noting or calling out, let's have you back on and let's talk about it.
Yeah. That means a lot, and I would love that. But I also want to, give you a shout because, your podcast and your audience, you're filling up a lot of great minds with the right information. So, I'm also, appreciate you for doing your due diligence and getting the word out too.
Well,
Means
thank
a
you.
lot.
Thank you for the kind words. I'm just here to facilitate the conversation and to bring on the experts to really, let us just peek into their minds a little bit and start to remove the stigma and misinformation and disinformation that's been put out there for so long. We gotta move forward with the times, and the work, like I said before, that Realm of Caring is doing is much needed, especially when our federal government is not stepping in, and when the healthcare system is hesitant to jump in due to the federal prohibition. So yeah, man, it's been a great conversation, Nick. Anything that you want to close with before we wrap up?
Definitely, check out our website, Realm of Caring Foundation, realmofcaring.org. We've got, great resources there as well. And even if you're not even, using, have a great research library to browse and other, resources as well. So definitely check that out.
Awesome. And we'll be sure to include those links in the description box within our YouTube video as well. So,
Fantastic. Appreciate that.
of course. Yes, Nick, thank you so much again. Really enjoyed the conversation, and I look forward to having you back on soon.
Awesome. Thanks for having me, Kevin.
Yes. And thank you all for listening. Bye.